Alright, this is Vital Signs video 3, and we are going to pick up where we left off. So let's practice to start with pulse. So break up into groups of 3, and the person in the middle will be the patient. And so then you want to find the radial pulse and take it for 30 seconds, then multiply by 2 and compare. Then you will move around and repeat until everyone has been the patient. All right, so pause the video here and break up into groups of 3. If there is an uneven group, then you can just work as a partner, but it's best to work as a group of 3. So please break up into groups of 3 and move around, because that way you can compare. So let's say that I had myself and my husband and my son, and they put me in the middle. Then my husband and my son are both taking my pulse on each side, and then they compare what they get just to see how accurate you are. Okay, if you get within 6, all right, so let's say that I get 30 times 2 is 60, and my partner gets 33 times 2 is 66, so we got 60 and 66. Then that is within the margin of error, so that's good. Okay, so you may have to get your pencils out so that you can do a little bit of multiplication, but take a few minutes, and you can use the clock as your timer and see what you get. All right, I hope you got pretty. Okay, let's move on to respirations. So respiration is the process of taking in oxygen and expelling carbon dioxide from the lungs. We've talked about this pretty much at length about the respiratory system and where the gas exchange takes place and all of that. So one respiration is 1 inspiration, 1 breath in, and 1 expiration, 1 breath out. Okay, so in a minute, when you count these, you need to remember that. So the normal adult rate for respiration is 12 to 24 breaths per minute. This could vary depending on which source you look at. Some say 12 to 20, some say 16 to 24, but the average is around 12 to 20 breaths per minute. All right, so let's think about some things that cause increased respirations. Exercise, obviously. Stress or anxiety is going to cause increased respirations. Respiratory distress. They don't feel like they can breathe. Think back to your diagnosis of the day with the allergic reaction. He wasn't able to breathe. And so respiratory distress can certainly cause increased respirations. What are some things that can decrease respirations? Sleep or relaxation. We could expect a patient that is resting to have lower respirations than someone that is up, walking around, and talking. Respiratory depression, if they have taken some type of medication, or maybe we have given them some type of medication, that can certainly cause respiratory depression. Or if they've been in respiratory distress for a while, then eventually their respiratory system is going to give out and go into respiratory depression. So here are a few important respiratory vocabulary. Dyspnea, we had in our last unit, that's difficult or labored breathing. Apnea, that's the absence of respirations. Tachypnea, you already know that tachy, T-A-C-H-Y, means fast. So tachypnea is rapid respirations, that's above 24 a minute. Bradypnea, you already know that brady means slow. So bradypnea means slow respirations below the rate of 12. Let me go back to that. So wheezing, we talked about in our respiratory diseases unit. This is difficulty breathing with a high-pitched whistling caused by those narrowing of the bronchioles, the small air passages. Cyanosis, you also know. This is a dusky blue coloration of the skin, lips or nail beds as a result of decreased oxygen. So those are both things that we don't want our patient to have. Okay, the thing about respirations is that we've got to count them in such a way that the patient is unaware of the procedure. You have had your respirations counted every time you went to the doctor. You just weren't aware of it. Respirations are partly under voluntary control, meaning if I say to you, okay, now I'm going to count your respirations, you might start breathing faster or slower, okay? So this is why we don't want the patient to know that we're taking their respirations. So you're not going to tell them that you're counting their respirations. What you're going to do here in a minute when you go to practice is you're going to leave your hand on the pulse site while you're counting respirations. And patients will think that you're still counting your pulse, their pulse. As you get more confident with this and as you practice it more, you'll be able to count their pulse for 30 seconds and then count their respirations for 30 seconds. And you'll be able to hold both numbers in your brain and then calculate them quickly. But it takes practice, practice, practice. So please don't get discouraged if this is not something that you get like right away, okay? It does take practice. So the best thing that you can do is, we're practicing in class, but when you get on the bus, is asking the person sitting next to you, can I take your pulse and respirations? When you get home, taking your parent or whoever you live with or your boyfriend or whoever, asking them, your friend, your best friend, asking them if you can take their pulse and respirations. The more that you do it, the more proficient you will get. So we count respirations for 30 seconds and multiply by 2. If they are irregular, meaning let's say we only get 8 and normal is 12 to 24, then we would count for a full minute. And we're always going to report abnormal values to the doctor or the registered nurse, whoever we're working with. Okay, so let's practice. We're going to do the same thing. Put one person in the middle, so break up into groups of 3. You will put one person in the middle. You're going to put your hand on the pulse site like you are taking the pulse, but then you want to watch for chest rise and fall, okay? So you're looking to see where you're seeing that chest rise and fall. 1 breath in and 1 breath out equals 1, okay? Just like lub-dub equals 1. So pause the video and practice that for a few minutes, and then we'll come back. Okay, I hope that you were able to get respirations. So at this point, what I would like for you to do is stay in your groups of 3 and practice a few times doing pulse and respirations. So this will take a full minute of you watching the clock and timing yourself between you and your partner. You can also get out your phone if you need a timer. We will practice with some watches later on. But practicing getting pulse and respirations at the same time, okay? So for the first 30 seconds, so you could set your timer for a minute. For the first 30 seconds, you're going to count the pulse. For the second 30 seconds, you're going to count the respirations, and then you're going to multiply both of those by 2 and see what you get, okay? Again, this takes practice, okay? And sometimes you may have to stop and, but you can always put your hand back on the pulse site and just pretend like you're taking the pulse again and take the respirations. The patient doesn't know the difference. Of course, you guys will know the difference because you're listening to this, but the patient won't know the difference, okay? So it takes practice. So at least work on doing pulse and respirations 3 times. So in your group of 3, one person will be the patient each time. Okay, good luck. This is the end of video 3.